My name's Gastroenterologist and you're watching Melomed TV. It's a new year and that means it's an opportunity to become a brand new you. Have you been struggling to lose weight? You've been trying all the diets, you've been training really hard, but nothing seems to work. Well, we might have the answer for you. Let's introduce you right now to Dr. Peterson. He's a physician and a gastroenterologist. He has a program. It's a procedure done in his room, no anesthesia. You don't have to go into theater. And if you follow this program, you could get your desired weight within 90 days.
The Lurian program, it's revolutionary. I mean, it's really a remarkable device. My experience as a physician, as a pharmacist and as a gastroenterologist, one thing has been clear is that we've been sending patients on fool's errands. We've been giving diet plans. Patients who have never lived a healthy lifestyle all their lives are given these healthy eating plans and told, go, this is the instruction that you need to follow. That is just not good enough. The implantation is the bolster to achieving your weight loss results. And why it's a program is that you need to have a dedicated team holding the patient's hand throughout the process. So if you look at, if I could liken it to something like bariatric surgery. So what bariatric surgery is, what we would refer to as reducing the stomach volume. Okay, and the aim of that is you reduce the stomach volume. You have hormones in the body called incretins, and you have stretch receptors in the stomach that tells you enough, you've had enough. And the balloon basically simulates that. So it occupies about 60 to 70% of your stomach volume. So what you're essentially doing is you're operating on the remaining 30%. So your caloric intake is substantially dropped. And how we further optimize your result is that your nutritional plan is also designed to maintain your nutritional requirements, but also to make sure that you remain in that caloric deficit that one needs in order to achieve weight loss. So it's about doing the mathematics of it. It's not just, there's an eating plan. It needs to be tailored for the individual. Why I love it is that it can be done in the rooms. It's a 20-minute procedure. We call it an implantation. So there's no endoscopy. You don't require a scope. There's no anesthetic drugs. There's no other. So you're really doing it in a so-called more natural way of putting an implant into a patient. It really requires a patient just to swallow a capsule. So the balloon is compressed into a little capsule that is easy to swallow. We help the patient in that process. They swallow it with a glass of water. It lands in the stomach. We confirm its position by doing a chest radiograph, and that basically shows us that the balloon is in place. And then there's a special filling solution that runs through a catheter that's attached to the balloon, and the balloon literally inflates within a matter of 5 to 10 minutes. We take a subsequent x-ray to confirm position, to make sure that it's perfectly placed, and once its position is confirmed, we remove the catheter. All of this takes about 20 minutes, up to 30 minutes, depending on how comfortable the patient is during the procedure. And with regards to the passing of the balloon, that's usually a common question. People are always asking, so how does this balloon get out of my body? So there is, it's actually very intelligently designed. There is a slow release suture attached to the balloon that dissolves by month 3. It dissolves the liquid that's inside the balloon, which is, it's essentially the same as normal saline or salt water that passes into the small bowel. It deflates to the size of a sweet, and most patients don't even notice it in their stool. They pass it in their stool. So there's no need to extract the balloon. There's no need to do any procedures related to the balloon. It all passes naturally. Yeah, so part of the tools is we obviously want to extend our hands beyond the consultation room, and we want to make sure that the patient stays on track. So Lurian has designed a smartwatch as well as a smart scale and an app, which is basically on my computer desktop, where I can actually track the patient's progress. So the patient weighs themselves at least once a week, and we can actually plot out the trajectory of the patient and ensure that if the patient is on track, we're smiling. If we see any deviations from the patient achieving the objective, then we obviously have to call the patient in. The team has a team discussion, and we see whether there are any areas that need to be worked on. For example, does the diet need to be tightened up? And one of the big things is the balloon still inflated? So we may need to do an X-ray on arrival to confirm that the balloon is in a good position and it has remained inflated. But by large, from implantation, usually by month 3, the dissolvable suture releases the solution. So your maximal weight loss is achieved actually within the first 4 months. And what that has shown is that about 15% of your total body weight will be lost within the first 4 months of the balloon being in place. The results of the studies is impeccable in that a year after implantation, 95% of patients maintain their weight loss, which tells you something that you've changed the way this person thinks, you've changed their lifestyle, you've actually really made a big difference in terms of optimizing the patient's lifestyle. And it's not just the balloon, it's actually the patient's hard work, dedication, the team's hard work and dedication that has reaped the benefits and the rewards.
Well, there you heard from Dr. Dale Peterson. It's all about a quality of life, and his program is guaranteed to have you see significant results. If you'd like to know more information, do not hesitate. Contact Dr. Dale Peterson right now. The details is on your screen. As always, take care of yourself and take care of your loved ones. Until next time, goodbye.